Hello, I am Dr. Barry Kashfian. I am practicing in Redondo Beach since 1988. Also, I do have a practice in Century City that is my first practice. I have started there in 1982. I'm a prosthodontist. I have been graduated from Boston University in 1980, and also since 1985 I am involved with dental implants. My first training with dental implants is with the Corvent dental implants in 1985. Then I continued my education with the International Congress of Oral Implantology. I took courses in cadavers, in bone grafting techniques, in placement techniques, and also I did take a 9-month course with the ICOI implant seminars, and I'm a graduate of that course. Since 1985 I have placing implants, but for the last 5 years I have been the most active. We have placed hundreds of units of implants, tens and hundreds of bone grafts with the dental implant surgeries. I do immediate extraction and placement of the implants, and we do cosmetic zirconium abutment, which is without any metal, cosmetic. Placement of the eyes would reduce the amount of the pain field that's needed. Usually, as the patient that we have a few minutes ago mentioned, most of the prescription for pain is going to be left unused because the precautions that we take during the surgery would prevent and reduce the amount of the pain to minimum. The reason that after the implant surgery the amount of the pain in most cases are minimal is because first we remove or extract an existing teeth without any trauma to the surrounding tissue, because we're going to need the surrounding tissue to hold our implant. So we're going to take our time, and we develop skills and technique to remove the teeth atraumatically without causing any traumas. That is processed human bone. The other issue is the bone grafting material that we use. We do have different bone grafting material. Open that also. Just a little tap you hear. No pain, but go ahead. Go ahead now. Go ahead. Go ahead. Go ahead. Tap it. Good. Now we go to the other side. To the side for the second implant. Which is, you put one sensor here, one lateral there. There's going to be sensor lateral. If you see, we are expanding this bone like this. We're adding about 3 millimeters to the bone. Okay? That's how it works. Going down easy enough. You feel that? It's the pressure. As soon as we remove that, the pressure goes away. Okay. So it just comes out. This is a small size. For the larger, we take the larger size, we go back to this one. Much easier. You can remove it like that. Just expand it. So this is called bone manipulation.
Where is it called?
Bone manipulation, right?
Where was it called again?
Bone manipulation. Expansion.
No, forget about that.
You okay?
No,
Okay. Good.
Yeah.
Compare the head of this implant. They're at the same level. You're pretty much the same. So I tell you some. Some bone back. Is the cantilever for tooth number 9, and we place the implant at the place of the tooth number 10. This way, we do have a lot of mesiodistal distance between the implant and the adjacent teeth or the adjacent implants. This way, we're going to have a very good blood supply, a very good circulation. The length of the implant is obviously is a promise that its restoration is going to last quite a few decades. Now, I'd like to show you the rest of the implants that have been placed for Annette. The upper left side, we have 2 implants with the cantilevering and the mesial, and this way we have utilized the entire amount of the bone that existed, and we do have a very good separation between the implants and the adjacent teeth. On the upper right side, which is on the left of the screen, we have 2 implants also is parallel. This one we cantilever distally and mesially, and we use the area going to the panoramic X-ray. The panoramic X-ray shows all the anatomical landmarks of the upper and lower jaw, the maxillary. You see the presence of the maxillary sinus and nasal cavity, and the correlation of the implants to the sinus and the nasal cavity, which is we have obviously used the maximum amount of the available bone for the retention, and also on the lowers, as I show you on the left side, which is on the right side of the, on the right side, which is on the left side of the screen, and it says R right underneath. You see the proximity of the end of the implant to the infradental nerve. But on the other side, we did have a little bit more availability for the bone, and we have used a longer implant with the less diameter because the bone was also very narrow. Now, I would like to bring your attention to the bridge that's cemented. It's on a tampon cement with Vaseline, and also we like to take a shot of the appearance of the lips and the cosmetic of the restorations.